Hi everyone, this lecture is about therapeutic communication. Therapeutic communication is a purposeful use of communication to build and maintain healthy relationships with patients. Isa itong key concepts sa healthcare, especially in nursing. It plays a very vital role in building trust, promoting patient well-being, and of course, facilitating the healing process. It involves both verbal and nonverbal techniques to support the emotional and psychological needs of patients. It's not just for physical and physiologic aspects of care, rather holistic care for the patient. What is the significance in nursing? First, it enhances nurse-patient relationships. Why? Because a patient who feels genuinely cared for is more likely to cooperate with the treatment plan. The patient will follow instructions and disclose vital health information. Second, it promotes trust and rapport. Trust is very essential in healthcare, especially when patients are vulnerable due to illness, hospitalization, or uncertainty. Through consistent use of honest, respectful, and compassionate communication, nurses will actually build rapport, and that will help patient feel very safe and secure. Third, it encourages patient expression of needs and concerns. Example, a nurse who uses open-ended questions like, "What worries you the most about your condition?" It can uncover emotional or psychosocial needs that may actually not surface through routine assessment. Next, it facilitates accurate assessment and patient education. A patient who actually understands the purpose or the side effects of a medication is more likely to take it consistently and reports adverse effects early on. And last, it reduces patient anxiety and stress. Example, a nurse sitting down and calmly explaining an upcoming procedure can actually help ease a patient's fear, leading to better cooperation and a more stable emotional state. What are the key characteristics of therapeutic communication? First, it is patient centered. It focuses on the needs, concerns, and experiences of the patient. For example, a nurse notices a patient hesitating to take medication. Instead of insisting to take the med, the nurse should ask, for example, "I notice you seem unsure about taking this medication. Would you like to talk about what's on your mind?" This would allow the patient to actually express concerns like fear of side effects, giving the nurse a chance to address them. Second, therapeutic communication is goal directed. It aims to improve the patient's health and well being. Another example, during discharge planning, a nurse can say, "Let's review your care instructions together to make sure you feel confident about managing your medication at home. What questions do you have so far?" So, this will actually ensure the conversation would lead toward promoting patient independence and safety. And last, therapeutic communication is empathic. It involves understanding and sharing the feelings of the patient without judgment. Another example, if a patient is diagnosed with a chronic illness, he or she would express fears and sadness. The nurse can respond, "It's completely normal to feel overwhelmed about getting news or after getting news like this. I'm here for you and we can work through this together." This kind of response will validate the patient's feelings and it fosters emotional support. What are the common techniques in therapeutic communication? First is active listening. You give full attention with the verbal and nonverbal cues. You pay attention to the total message. and you actually use all your senses to listen. Second is silence. You allow patient time to reflect and express themselves. You accept pauses or silences in seconds or even minutes without any verbal response. You can sit quietly and just wait until client is able to put thoughts and feelings into words. Another technique is using open-ended questions. You encourage detailed responses. Example, you let the patient tell the story. You ask, why, how, tell me more, how does that make you feel? Can you give me an example or can you describe that for me? Next is rephrasing or paraphrasing or restating. You simply rephrase what the patient said in order to verify. For example, you said that being at the hospital makes you feel sad. You just reaffirm or make sure that you understand what the patient just mentioned. Fifth is clarification. You ask for more details to understand fully. Example, the patient said, I vomited this morning. You can ask, was that after breakfast? You just help the client clarify an event, a situation, or happening to give you further details about the incident. Sixth, reflection. You encourage patient to reflect on their feelings or thoughts. For example, do you think I should tell my husband? The client would ask you. And you can reply by saying, you seem unsure about telling that your husband. Directing ideas, feelings, questions, or content back to the client. So you enable them to explore their own ideas and feelings about a situation. Another technique is summarization. You review the conversation to ensure mutual understanding. For example, during the past hour, we have talked about like this, like that. It's useful at the end of an interview or to review a health teaching session. It can actually act as an introduction to your future care planning. Next, is being specific and tentative. You avoid being general and you avoid absolute statements. For example, instead of asking, are you in pain? It's a general statement. You can make it a specific statement by, can you rate your pain on a scale of 0 to 10? Next is using touch. Using touch reinforces caring feelings because tactile contacts actually they vary considerably among individuals, families, and cultures. The nurse must be sensitive enough to the differences in attitudes and practices of client and self. Sometimes, depending siya sa culture, you put an arm over the client's shoulder, you place your hand over the client's hand. Those are ways of communicating using touch. But then again, consider that sometimes your patients vary. Your patient's attitude vary. Your patient's response to the touch vary. So you have to consider that. Next, you offer self. You suggest your presence, your interest, or you are there, your wish to understand the client. Example, I'll stay with you until your daughter arrives, or we can sit here quietly for a while. We don't need to talk unless you would like to talk, or I'll help you dress to go home if you like. Another example is giving information. You specifically give a factual information the client may or may not request. You provide a simple and direct manner. For example, your surgery is scheduled for 1 a.m. tomorrow, or you will feel a pulling sensation when the tube is removed from your abdomen. Next, you acknowledge. You give recognition in a non judgmental way. Sometimes you give recognition because there's a change in behavior, there's an effort the client has made, or there's a contribution to the communication. Acknowledgement may be with or without understanding, verbal or nonverbal. Example, you trimmed your beard and mustache and washed your hair. Or, I notice you keep squinting your eyes. Why? Are you having difficulty seeing? And the last technique for communication, presenting reality. You help client differentiate the real from the unreal. For example, the telephone ring came from the program on the television, or I see shadows from the window covering, or your magazine is here in the drawer. It has not been stolen. It is not lost. The nurse should also consider barriers of communication, and here are the several barriers that we will discuss. First is stereotyping, offering generalized and oversimplified beliefs about groups of people that are based on experiences which are too limited to be valid. For example, 2-year-olds are brats, women are complainers, men don't cry. Most people don't have any pain after this type of surgery. We have to avoid these statements. These responses categorize clients and negate their uniqueness as individuals. Another barrier is agreeing or disagreeing. You imply that the client is either right or wrong and that the nurse is in a position to judge this. These responses deter clients from thinking through their position, and it may cause a client to become defensive. Example, client says, I don't think Dr. Broad is a very good doctor. He doesn't seem interested in his patients. It's not correct to say Dr. Broad is the head of the department. He is an excellent surgeon. Next, being defensive. These responses prevent the client from expressing true concerns. For example, the client would say, those nurses at night, they must just sit around, they talk all night, they didn't answer my light for over an hour, and the nurse would say, I'll have you know we literally run around on nights. You're not the only client here, That's very, very defensive. You attempt to protect a person or healthcare services from negative comments, so you avoid being defensive. Next is challenging. These responses indicate that the nurse is failing to consider the client's feelings, making the client feel it's necessary to defend a position. Let's say a client says, I feel as if I'm dying, and the nurse says, how can you feel that way if your pulse is 60? You give a response that makes the client prove their statement or a point of view. Next is probing, asking for information chiefly out of curiosity rather than with the intent to assist the clients. I was speeding along the street and didn't see the stop sign. You would ask, why were you speeding? That's not a priority question. You are probing the patient. These responses are considered prying and they actually violate the client's privacy. Next is testing. These responses permit the client only limited answers and often meet the nurse's need rather than the client's. Do you think I am not busy? And it actually forces the client to admit that the nurse is really busy. You ask questions that make the client admit to something. So you have to avoid that. Another barrier of communication is rejecting. These responses often make clients feel that the nurse is rejecting not only their communication but also the client themselves. For example, you say, let's just discuss other ideas or other areas of interest to you rather than those problems you keep mentioning. Or, I can't talk right now. I'm on my way for coffee break. You're avoiding the client, you're avoiding the communication. You have to refuse. No, you are refusing to discuss certain topics which actually interest the client. Another is changing topics and subjects. These responses imply that what the nurse considers important will be discussed and that clients should not discuss certain topics. For example, the client would say, I'm separated from my wife. Do you think I should have sexual relations with other women? And the nurse would say, I see that you are 36 and you like gardening. The sunshine is good for roses. I have a beautiful rose garden. You avoid the discussion. Directing the communication like this into areas of self interest rather than considering the client's concern. It's often a self protective response to a topic, and it can cause anxiety to the patient. Next, unwarranted reassurance. These responses block the fears, feelings, and other thoughts of the client. I'm sure everything will turn out all right. Don't worry. We have to avoid reassuring patients. Using cliche or comforting statements of advice as a means to reassure the client sometimes could just give them a sense of fear as well. Next is passing judgment. These responses imply that the client must think as the nurse thinks, fostering client independence. For example, you shouldn't do that, or that's not good enough. Giving opinions like this and the approving or disapproving responses, moralizing or implying one's own values, we have to avoid that. And last is giving common advice, telling the client what to do. These responses deny the client's right to be an equal partner. For example, should I move from my house to a nursing home? The client asks, and the nurse would say, if I were you, I'd go to a nursing home where you'll get your meals cooked for you. We have to avoid that. Note that giving expert advice rather than common advice is therapeutic. And that's the end of the lecture for therapeutic communication. Thank you very much.